the ability to use current anti-seizure medicines in a more kind of precise way for epilepsy, especially related to the genetic epilepsies. So I think the current state of all of precision medicine is a bit of a broader topic that has a lot more to it. So basically, I talked about a number of more common genetic epilepsies and what therapies we have that can be used in a more targeted way to treat them. So one of them was KCNQ2, which has been associated with both self-limited neonatal seizures as well as a more severe epileptic encephalopathy phenotype. I talked a little bit about some potassium channel blockers that are in the pipeline because our prior potassium channel blocker has been removed from the market. That was Potiga or ezogabine. But there is some evidence that children respond to sodium channel medications because the sodium channel and potassium channel are localized together on the axon initial segment. And so a lot of these children will respond to sodium channel blockers as well. So we discussed the kind of case reports and literature that is available in that situation. We also talked about the use of vigabatrin in tuberous sclerosis. That's a relatively common neurogenetic diagnosis. And I think there's been a lot of interest in using that as kind of true precision medicine to alter the disease course. And there have been some promising trials, although the recent PREVENT trial that came out in August did not necessarily show a benefit to preventing the development of epilepsy in children who were pre-treated with vigabatrin. They did have a lower incidence of infantile spasms that started a bit later, but none of the other endpoints were significant, although that may have been because they had a low number of patients or their enrollment was not as I guess, robust as anticipated. So I think that was a second one. We also talked about the use of perampanel in GRIN disorders, so disorders of ionotropic glutamate receptors, and those come in a number of different flavors. There's not much evidence. There was only 2 single case reports, and that medicine is a positive allosteric modulator of AMPA receptors and was used in a couple of children with some benefit. I mean, most of these are not robust studies that are done with randomized controlled trials, but are, small series of patients from either a single or a number of different institutions that have shared data.